If you're suffering from anxiety or insomnia, you may have heard of the medication Ativan. While it can be helpful in alleviating symptoms, it's important to be aware of its potential side effects. Understanding these common reactions is crucial for anyone considering Ativan as a treatment option. Ativan, also known by its generic name lorazepam, belongs to a class of drugs called benzodiazepines. It works by enhancing the effects of a neurotransmitter in the brain, resulting in a calming effect. However, like any medication, it can have some unwanted side effects. Common side effects of Ativan. Ativan is known to have several common side effects that may occur when taking the medication. These side effects are generally mild and tend to improve as your body adjusts to the medication. It is important to note that not everyone will experience these side effects, and the severity may vary from person to person. Physical side effects of Ativan. One of the most common physical side effects of Ativan is drowsiness. Many individuals report feeling excessively tired or fatigued after taking the medication. This drowsiness can impair your ability to perform daily activities and may interfere with your productivity. It is important to avoid operating heavy machinery or driving a vehicle until you know how Ativan affects you. In addition to drowsiness, Ativan may also cause dizziness and impaired coordination. These side effects can make it difficult to maintain balance and can increase the risk of falls, especially in older adults. It is important to take caution when standing up or changing positions to prevent any accidents that may result from these side effects. Psychological side effects of Ativan. Along with the physical side effects, Ativan can also have psychological effects on individuals. Some people may experience memory problems, confusion, and difficulty concentrating. These side effects can affect cognitive function and may impact daily activities that require mental clarity and focus. Furthermore, Ativan can cause changes in mood, leading to feelings of sadness, irritability, or even aggression. It is important to monitor your emotional well-being while taking Ativan and seek help if you notice any significant mood changes that persist over time. Long-term side effects of Ativan. While the common side effects of Ativan are generally mild and temporary, there are potential long-term side effects that may occur with prolonged use or high doses of the medication. It is important to discuss the risks and benefits of long-term Ativan use with your healthcare provider before making a decision. Dependency and addiction. One of the major concerns with long-term use of Ativan is the risk of dependency and addiction. Benzodiazepines like Ativan are known to be habit-forming, especially when taken for an extended period. Regular use of Ativan can lead to tolerance, where higher doses are needed to achieve the same effect, and withdrawal symptoms may occur if the medication is stopped abruptly. Cognitive impairment. Another long-term side effect of Ativan is the potential for cognitive impairment. Prolonged use of benzodiazepines has been associated with memory problems and difficulties with attention and concentration. It is important to weigh the potential benefits of Ativan against the risks of cognitive impairment, especially for individuals who require long-term treatment. Increased fall risk in older adults. In older adults, the use of Ativan can increase the risk of falls and fractures. The drowsiness, dizziness, and impaired coordination caused by Ativan can make it more challenging to maintain balance and stability. It is crucial for healthcare providers to carefully consider the risks and benefits of prescribing Ativan to older adults, taking into account their individual health and mobility. Managing and minimizing Ativan side effects. While some side effects of Ativan may be unavoidable, there are steps you can take to manage and minimize their impact on your daily life. It is important to follow your healthcare provider's instructions and recommendations for taking Ativan to optimize its effectiveness and minimize side effects. Start with a low dose. To minimize the risk of side effects, your healthcare provider will likely start you on a low dose of Ativan and gradually increase it if necessary. Starting with a lower dose allows your body to adjust to the medication more gradually, potentially reducing the severity of side effects. Take Ativan at the right time. Timing is crucial when taking Ativan. Depending on your condition, your healthcare provider may recommend taking Ativan in the evening or before bedtime to help with sleep. Taking it at the appropriate time can help mitigate daytime drowsiness and allow you to function more effectively throughout the day. Avoid alcohol and other sedatives. Alcohol and other sedatives can enhance the sedative effects of Ativan and increase the risk of drowsiness, dizziness, and impaired coordination. It is important to avoid consuming alcohol or using other sedatives while taking Ativan to minimize the potential for adverse effects. Regularly assess the need for continued use. It is essential to regularly assess the need for continued use of Ativan. Benzodiazepines are generally prescribed for short-term use due to the risk of dependency and addiction. If you find that your anxiety or insomnia symptoms are improving, discuss with your healthcare provider the possibility of tapering off or discontinuing the medication. When to seek medical help for Ativan side effects. While most side effects of Ativan are mild and tend to improve over time, there are instances where you should seek medical help. If you experience any unusual or severe side effects, it is important to consult your healthcare provider promptly. Some signs that may indicate the need for medical attention include allergic reactions. If you develop a rash, hives, swelling, or difficulty breathing after taking Ativan, seek immediate medical attention as this may be a sign of an allergic reaction. Mood changes. If you experience significant changes in mood, such as feelings of depression, increased anxiety, or thoughts of self-harm, it is crucial to seek help from a healthcare professional. Worsening of symptoms. If your anxiety or insomnia symptoms worsen or become unmanageable while taking Ativan, it is important to discuss this with your healthcare provider to explore alternative treatment options. Alternative treatments for anxiety and insomnia. While Ativan can be an effective treatment option for anxiety and insomnia, there are alternative treatments available that may have fewer side effects or be better suited to your individual needs. It is essential to discuss these alternatives with your healthcare provider to determine the most appropriate treatment for you. Some alternative treatments for anxiety and insomnia include cognitive behavioral therapy, CBT. CBT is a form of therapy that focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety and insomnia. It can be highly effective in managing these conditions without the need for medication. Relaxation techniques. Techniques such as deep breathing, progressive muscle relaxation, and meditation can help reduce anxiety and promote better sleep. These techniques can be learned through self-guided resources or with the guidance of a therapist. Lifestyle modifications. Making changes to your lifestyle can also have a significant impact on anxiety and insomnia. Regular exercise, a healthy diet, and good sleep hygiene practices can contribute to improved overall well-being and reduce the need for medication. Conclusion and final thoughts on Ativan side effects. Ativan can be an effective medication for the treatment of anxiety and insomnia, but it is important to be aware of its potential side effects. Common side effects include drowsiness, dizziness, and impaired coordination, while more serious side effects are rare but can occur. It is crucial to discuss any concerns or personal health history with your healthcare provider to ensure that Ativan is the right choice for you. Remember that everyone reacts differently to medication, and what works for one person may not work for another. It is important to have open and honest communication with your healthcare provider to find the most suitable treatment approach for your specific needs. If you experience any unusual or severe side effects while taking Ativan, seek medical attention promptly. Your healthcare provider is there to help and can guide you through any necessary adjustments to your treatment plan.